Ethics. In ethics. Not in ethics. Safety, anatomy and physiology. What is the anatomy and physiology? You guys are done? Post feedback?
Yes, done.
Okay.
Yes.
Hani, you are back? Hani, are you back? I'm doing the attendance.
Sorry?
Are you back in the class?
Yeah, I'm here. I'm here.
Okay, so okay. Okay, so yeah, okay, good. So I am going to do the attendance. And Hani, you got my message yesterday, right?
Yes, yes.
So after the class, you are okay to do?
Of course, yeah.
Okay. After the class, I can give you the password. You have to do the exam. I am allowing it today, but we are not supposed to allow it until you complete the previous one. Okay. But as you had some emergency, so I am giving that opportunity today. Okay. Okay. No problem. Okay. So let me go to the what is called the student dashboard. Okay. Where are we? Just take attendance. Okay. I know everybody is already. Huda,
Present.
Christiana,
Hi, good morning. Present.
good morning. Yusra,
Yes, present.
okay. Amina,
Present. Good morning.
Inghong,
Good morning. Present.
okay. Alexia,
Present.
Zenaida,
Present.
Azardo,
Morning.
Santiago,
Here.
Zoana,
Here. Good morning.
okay. Chris Marnell,
Here.
Tara,
Here.
Annie is here today. Okay. Sabana,
I'm here.
Asinet, Morgan, Luis, Luis. What happened? Luis, I saw you in the video. Where are you on now? Luis. Went to washroom. Evelyn,
Good morning. Present.
Rugiato, Rugiato. Hello.
Good morning.
Okay. Maris.
You know?
Good morning.
Maris.
Good
Okay.
morning.
Varna.
Good morning.
So I didn't hear.
You go to Ghetto?
Yeah.
And my mark is giving me a shock.
Yeah. I understand that. Okay. Okay. So good. Everybody is here. So your course feedback is done. Good. Yes, good. So, this is not this one. Student dashboard 2. I don't need this. So what is this one? So this is so okay, those are APMT. Okay. Just to give a very quick update, this course name is APMT, Anatomy, Physiology, Medical Terminology. That's why it's called the APMT. We are going to spend 100 hours together, and there is no practical on that. That is 100% theory. And we need the prerequisites for go to enter in the course, that you have to pass the ethics exam. Okay, till now I know, except Hani, everybody completed all the exams. So Hani has some emergency, so he's going to take the exam till I allowed him to be on the course. Till now, I don't know the marks we have passed or failed. I hope everybody got a good marks, and I have the confidence on you guys. In case something happens, then probably you have to do the supplemental exam. In case, and I don't think so. I am 100% confident on that. So we don't have the co-requisites anything, and that's very, and you know the course objectives everybody sees. So we are going to learn about the terminology first. What are the common root words in medical terminology? What type of terminology we use, and what is the meaning, from where it comes from, how it develops. So these are the things we are going to learn, and then we are going to do the anatomy. Is going to be the body structure and their function, how it works, what is the physiology, kind of like that, which gland secretes which hormone, which organ is more important, how it function. So it's good to know about, probably when most of you has passed the school, exams, or somebody at the graduates, and so in general you have the idea about our body system. This is kind of refreshing, but till when we forgot, we passed our school age, till we probably forgot basically the lot of internal things. So we have to refresh about that, and we'll go from there. Okay, so go this one. This is basic about the course syllabus and theory. Okay, so next, anatomy and physiology, right? Ethics professionalism, getting started, unit 1. So we are going to start with the unit 1 today and see if we can move up a little bit to the unit 2. Okay. So this is your Quizlet link. So you can practice the Quizlet here. Okay. Even I didn't open this one before. Let me see what is that. Yeah, you guys do this one and practice sometimes. Okay, Quizlet link. Ooh. So what is the course note? Let us see. That's I told you, medical terminology is the language of medicine, so that everybody can understand. One terminology is going to everybody, whole world, globally, it can be understood. It's not region to region, country to country, state to state. So without this language skills, the medical environment is confusing and difficult to understand. So that's why you have to know the terminology. So what we are going to know, different things, what is combining form, what is combining vowel, what is prefix, what is the root word, what this means suffix, what this means word elements. So what is the object? When you see any word, you have to analyze the words by dividing them into component parts. Say for example, I'm telling cardiology. We are going to learn later. So everybody knows cardio means heart. So whole world knows cardiology, and logy means study. So cardiology means study of heart. Biology, we are running the biology. Bio means life, and logy means study of life. That is the biology. So these are the medical terms we are going to use. So now, word analysis. Your first job in learning to language is to understand how to divide the words into their components. First is the root word. What is the root word? From where we are constructing this medical term. So root word is the foundation of the word. It gives the word its meaning. All medical words have one or more root words. Say for here, if I say cardiology, you are dividing it to cardio and logy. So what you think is the root word? Here, in your thinking, what is going to be the root word? Which part of the word is giving you the meaning of the medical term? Cardio, right?
Cardio.
Cardio.
Yes.
Because logy can be with the biology, sociology, everything. Logy is the study. But cardio is the root word, which is giving you the meaning that we are going to talk, or we are discussing about something, the heart. Suffix is the word ending. It modifies the root word, the meaning. All root words have suffixes. Cardio, suffix is logy, is giving you the meaning. What is root words meaning? Cardio, we are talking about the heart. And logio means study. Clear? When you are going to learn more root words and the suffix is at the end of the root word. And prefix is at the beginning. Pre means before. Pre is added to the beginning of the root word to modify the meaning. Not all root words have prefixes. So be careful. This question is going to come. All the root words has the prefixes or not? No, not all. Prefix when is needed. But your root word and suffix is going to be always. Prefix sometimes to be more specification, we use it and it comes before the root word. So how it comes? If there is three, first prefix, then root word, then the suffix. If there is no prefix, there is no need, root word and suffix. Write it down in your note. These are going to be very important for your questions. These are the may come. Whether the all medical terminology or all the root words have prefix or not? No, it depends. So combining vowel. What is the combining vowel? Who connects the two word elements? That is called the combining vowel. Generally O links the root to the suffix. What is the suffix? Which is at the end. Example, same thing I am giving the cardiology. Cardio is heart. O. Cardiology. This O is connecting between the cardiac and logy. So cardiology. So this O links the two root words. Root words and the suffix to give the meaning. So combining vowel doesn't have any meaning by its own. No meaning. But when it combining two parts of a word, so it's giving a meaning. Cardiology. It doesn't mean cardiology. Cardiology. So combining form is the combination of the root word and the combining vowels. What is the combining form? Hematology. Hemato means blood related. So so combining form is when hemato, this is the combining form. So that means when these root words with this combining vowels O is added with the another part of the suffix, then is making the full medical term. Hematology. Logy is going to the suffix. Hematoma. That is the inflammation or the swelling of the vein. Hematoma. So here we are dividing the hematology. Root word. Combining vowel and this is the suffix. What I was telling. I use the cardiology, they use the hematology. So hemat is the root word. O is the combining vowel and logy is the suffix. Here, hemat means blood, logy means the process of study, and O is the combining vowel. So you can put it anything, cardiology, nephrology, gynecology, anything, parasitology, biology, anything you write. So it's going to be the same thing. Parasite is going to be the root O-logy. Nephro means kidney. So neph is going to be the root word. O is going to be the combining vowel and logy is going to the suffix. Nephrology. So if you know meaning of one, is going to be the root words are different, but the combining vowels and the suffix also different. So, but it can be combined with lot of root words to give the meaning of the study. So, logy is study, hematology is study of blood, nephrology study of kidney, urology study of urinary structure. So, everything is like that. So far, any questions? Any questions?
Clear.
No,
good, thank you.
Okay.
No,
So now
thank you.
sometimes we have the little bit root word can be one, root can be two or three, depending upon what the medical terminology. But suffix and combining vowel is going to be with them. Suffix is going to be one. But so when everybody knows the electrocardiogram, what that means is the ECG, right? Checking the heart function, how the heart is functioning, is how the heart's electrical activity is working. So electrocardiogram. Here we are using two root words with their combining vowels and one suffix. Electro means everybody, we need the electricity. I already told you O is the combining vowel. Cardi means heart and gram means record, to record, because you are printing it, right? You are recording it in the ECG machine and then it's going to, when it's going to, see, this is the electrogram is record. When is going to be the electrocardiograph, then it's going to the picture. So these two are going to be the same, only changing the suffix, you can change the meaning. So gram means record. You have to, they are going to give you this medical term and may they ask you to divide it. Which one is has the root, what is the suffix, what is the prefix, how many roots are there, which is the combining vowel, and what is the combining form. If I ask you how many combining forms here, how many? There are one or two?
Two combining vowels.
Two combining tails. Say electro one and cardio. So this is the combining form. Electro and cardio. These are the two combining forms. This is combining vowel is O. This electro and cardi. These are the two root words and there is only one suffix. It's called the gram. Now, gastritis. Everybody knows gastritis. When we have the gastritis, we have pain with the gas in the stomach. This is called the gastritis. Here, we have only two. Gast means is the root word. Gast means stomach. And itis, you have to remember, itis means inflammation. So these you have to remember, the two things, itis, anything, nephritis, inflammation of the kidney. Carditis, inflammation of the heart. Bronchitis, inflammation of the bronchus, part of the lung. So itis is inflammation and root words is changing. So either root word and the suffix, they are playing major role in giving the name of the medical term. So drop combining vowel when suffix starts with the A vowel or an as an itis. Okay, so U doesn't need a combining vowel O. When it starts, the suffix is starting with the I or any vowel. Okay, so you can starting with the I. Carditis, there is no cardioitis, but logy, L is the, when you are doing the logy or gram, This gram is, what is that? This is the consonant. It's not a vowel. So that's why here's the electrocardiogram. If there is I, if I say iram, then there will be no, it's going to be electrocardiogram, because there will be I already on vowel. So if after the root word, the suffix start with a vowel, then there is no need of a another combining vowel, because this is already a vowel here. So you doesn't need a vowel. So you know the words, the A, E, I, O, U is the vowel. So anything the suffix starts with a vowel, there is no need of combining another combining vowel. So we drop that combining vowel. Say for the gastro, now we are going to gastritis, you see in the simple form. Now gastroenterology, there are now two root words. So gastro is stomach, enter means look at the intestine. When you are going to read the body parts, you will see the which part is the gastro, which part is the entero. You know, entero is down the stomach, gastro is upper part of the stomach, and gastro is mainly the intestine. So that is, again, see, this suffix is L, so we have to use combining vowel, gastroenterology. So we have, if I ask you how many root words it had, it has two root words. How many suffixes had? Only one suffix. How many combining vowel it has? Two combining vowel. How many combining form it has? Gastroentero. So when I am asking the combining form, that you have to tell gastro, including the vowel, the combining vowel, gastro. That is the combining form. Write all the notes in your paper. Gastro, entero. This is the combining form. Combining vowel is only the O, which is combining with one to another one. And last one is the suffix. Once again, if the suffix starts with any vowel, there is no need of the additional combining vowel. So we can drop the O. Clear? So gastro means stomach, enter means intestine, and logy means the process or the study. So what are the three general rules? First, read the meaning of the medical terms from the suffix back to the beginning of the term and across. Drop combining vowel usually before a suffix begin with a vowel, like gastritis, not gastroitis. Gastritis, not gastritis. Keep the combining vowel between two roots, like the gastroenterology, not gastroenterology. I told you, so it has to be combining vowel, the gastroentero, then logy. So now another example, eek. It is starting, first we are starting from the left to right. That's the tell, we have to start with the suffix to the left. So now just we talked about the root and the suffix, but at the beginning I told you there is sometimes need of the prefix word to give you the emphasis, the condition. So here, if we see the suffix, it's starting with I, so we don't need any, first of all, combining vowel. Then we are talking about the stomach, gast, and then we are adding another word which is going to give you the meaning, the condition, state. So hypo means below, hyper, say for example, these are the two very common example. Hyper means above. So what this means, we have a prefix. This is called the prefix, which is giving us, stating some condition. Prefix. So hypogastric, that means you have the gastric activity below normal. And it is pertaining to, means going to, hypogastric, it is going to be below active normal. Your stomach is not active as a normal, is giving the low activity. HIPAA is a hyperactivity, hypergastric. Also, hypergastric means is more highly basic active. Okay. Okay. So AP means above the stomach. Hypo means below region. AP means above, and sorry. So here you have the prefix AP, others are same, root suffix. So AP means above. So that means which area is the above the stomach area? Hypogastric is the below. So pronunciation of medical terms. Sometimes it's a chronic. It sounds at the end like K, chronic, but spelling is C. So this you have to remember. Most of the terms we know, but you have to do the things. Say part, pronounce this J when the G comes before E, I, and I. Say example, genetics. So we call the J. Actually, we call the genetics. It doesn't say the genetics, right? We don't say G, we say J, genetics. That's what they're telling. Genitals. It sounds, the G sounds like the J, not the G. It doesn't say genitals, we say genitals. So essentially bacilli, right? C sounds like S. So this is the bacilli. Pneumonia, we drop the P. You all know pneumonia. We never use the P. Pronounce this N as though the P was absent, but P is there. But when you are going to write the name or the terminology, you have to use the P. So sometimes pneumonia. There is another bacteria or virus, is called the Pseudomonas, but it starts with the P. Pseudomonas. So these are the examples. What is the little bit? So now we are going to learn about the different types of prefixes. I am going to describe you, but this is the majority of the, you have to remember, this is a huge list of everything, which is the, prefix, which are the root words, which is the suffixes. When you use a or an, anything prefix, is called meaning the absent or away. A or an is absent, AB is away or from or deviation. So example, a or an, absent, definition is absent. A plastic, something that is no symptoms. It is nothing is there, aplastic. AB is away from, that means it's deviation from. Abnormal is not the normal, is away from the normal or deviation from the normal. That's called the away. Anything started with the AB, the prefix, it's going to means the away. Anything starts with the A and N is going to tell you the absent. AD is going to show you the direction, addiction. Aniso, unequal. Aniso means unequal. Anisocytosis. This we are going to, when you are going to learn the different other root words and other things, that is going to give you the meaning. Anisocytosis, that means the different type of cells. Cyto is cells, so different type or size of cells. So unequal. Anti means before. Antepartum, before the delivery. Anti. But when is anti, there is two things. Anti is before. And at the same time, if you say anti, against, when you are answering, be careful. You see the anti, don't think is anti. So you have to watch whether they are giving the anti or anti. Anti is before, antepartum. Anti is against, like the antiseptic. Antiseptic we are used to prevent the sepsis or any infection. So it's fighting against the infection. So that is the anti-infection. That's called the antiseptic. Auto means always self. Auto-regulated, self-regulated, right? Auto means self. Everybody knows auto transfusion. Baso define the blue color. Basophilic means is going to take the it looks blue or is going to take the blue color. Its appearance is bluish. Bio means life. Example, we already talked biology, study or in the process of studying of the life. Brady means slow. Bradycardia, slow heart rate. Here, cardi is heart. Going to tell you the so how is telling you doesn't need always the suffix here. Bradycardia is only giving the prefix and the root words is giving the meaning here. You can see bradycardia, low heart rate. Circum means around some structure. It's called circumcision. Contra is against. Again, contra means against. And sometimes they use anti is against. Sometimes they use the contra and against. Contraception. Cyto is going to tell you the meaning of cell. Any cyto. So everybody, anything comes with the cytosis. Here you can see cyto. Cyto is cell. Aniso, unequal. And cis is going to condition. Osis, cytosis. So here is the combining vowel, here is a combining vowel. Aniso, this is the combining vowel, this is the combining vowel. Aniso is the combining form, cyto is the combining form. And osis is the condition. So, no, sorry, osis is the condition. So you don't need the, here O is starting with the vowel. So cyto is cell, osis is the condition. So it's going to describe 3 words. The cells are unequal sizes or unequal diameter or unequal colored, anything. Di means two, say dimorphic, two types of morphology. Dia means through, dialysis. Diaphragm is through. When is going through is called the dia. Diplo means double. Di, there is no confusion. Di means two. Maybe there are two things there is di, and diplo means double. Same thing in double. Diplococcus. So in the same thing in double, there are two. It's called the diplococcus. This to cut apart, dissection. Dissect. To cut out. Dissection. We are going to dissect your appendix. That means we are going to take out your appendix. So dissect. This, anything comes with the this means painful or difficult. Dysfunction, dysuria, anything. This is painful. Dysfunction means painful. Something is painful. Dysuria, painful in urination. That's called the dysuria. Ex ecto, out from. Ectoplasm is out. Endo means within. Endometrium. Entero is intestine, so enterococcus. This is another example. AP, above, X, out from. So when we call the epidermis, AP means above. What is the outer layer? The epidermis, the most upper or above layer is the epidermis. If I say hypodermis, that means it's the below, lower. We just talked about the hypo means below. Ex, out from, excise, take out. But we have to do the excision. Party of your stomach or party of your liver. So that means we have to get it out. Hema, blood. You are going to use this one lot. Hematology, study of blood. Hemi is half. What is the another terminology we use? Hemi means half. When you are cutting it, the hemisphere, we have two hemispheres. So 1 and 1. So it's a half. Hyper, everybody knows excessive. Hyperchromatic, hyper activity, anything. Hyper means excessive. At the same time, hypo means decrease or less. Hypothermic, that means body temperature is low. Hyperthermic, high body temperature when you have fever. Hypothermic, when it's low body temperature below the normal. Always it comes with the normal. Hyperthermic, if I say, is the temperature above normal. Hypothermic, temperature below normal. Hyperchromic, more color. Chromic means you are going to learn. Chrome is color. Hyperchromic is more colored. Hypochromic, less color. So from the intensity, sometimes you can understand the disease condition. Inter means between, intercellular, between the cells. Intra means inside or within the cell. What is going on inside the cell, within the cell. And inter means what is like. We have learned in ethics, interdisciplinary team, right? Remember the nurse, physician,
Yes.
inter. And that's the, and when is, if it is in the same department, it's going to be the intra. So iso means equal, isometric. Macro means large, macrocyte means the cells is really big size, is probably getting inflamed or some disease condition. Macrocyte. At the same time, it is going to come later. They are giving the alphabetically. So macro is large, micro is small. Like the we have said, the microbiology. Micro is a very small. Which is the smallest? Your virus, bacteria, all the pathogens, they are the very small. So when you are going to microbiology, study of life of the microorganisms. Mal is bad. Separate mal absorption. Your absorption is not good. You are having suffering from malabsorption. Whatever eating is getting waste, is not getting absorbed. The properly what is need to be absorbed is not going absorbed. Mega or megalo is huge. So megaloblast is huge. Means when megali, when the development cell is really, say for example, or any organ is going to be really huge due to the inflammation or some infection. Meta is after or next. Metastasis, that is comes in the cancer. This is the stage 4 or stage 3. So when the cell became already cancerous, what is going to be the next stage is going to showing. It's the meta is after or next. Micro, as I told you, micro is small. So microscope. Micro means small, scopes mean from which you are going to see the cells. So micro and scope. Scope is an instrument. Microscope, an instrument, the instrument which can help you to see the microorganisms. That is the microscope. Mono means one, monolayer. Morpho means shape. It's going to tell the morphology, how it looks like, what is the shape, not the size. Morpho is the size, whether it's the diamond shape, is a round shape, is irregular in shape, anything. What is the morphology? Neo means new, means generation. Sometimes it's come the new or new generation, generation of something, formation of something. That is the new. Neonatal. It's a new baby just born. Neonatal, NICU, neonatal. Everybody knows neonatal. Necro means dead. Necrosis, Part of your kidney means part of our kidney cells has been damaged, is dead. Anything necrosis in any place is going to be the death of the cells. Necrophobia. Phobia means fear. So when from the necrophobia you are feeling there is nothing there anymore you can do, that is the necro, is dead. Neutro means neutral. Everybody is neutral color we use. So neutrophilic, which doesn't works, is neutral. It doesn't interaction with anything. It's a very neutral color, kind of like that. Now there are a lot of prefixes. Oligo is few. Oligouria means not sufficient urine. Ortho, straight, like the orthopedic. Pan means all. Like pancytopenia is all. Para, beside. These all you have to remember. Peri, around. Example. They give always giving the parallel example. Paraplegic. Peri means around. So these are going to change. These are giving the example, right? Oliguria, orthopedic. So this, when you are coming with the ortho, something other things is going to change the meaning. Para means beside. Peri means around, like the circumference. Phago means eat. Phagocytic means which eat the other things. The phagocytics. Poly means mean. Post, behind or after. Pre, peri. Peri is around. We do it. Phago is eat. Poly means many. Post means behind or after. Postnatal. Postpartum. Postpartum means after delivery. Postnatal means after the baby was born. So that's the then postnatal. Pre means before. Prenatal. Prepandum. Sometimes you need the prepandum blood sugar, means fasting blood sugar. That is the prepandum. Postpandum means after the meal. So pre and post is going to state you the condition. What is the time? Approximate time. The state of the time is the before or after. These questions come. The pre and post. Pseudo means false. Pseudopodia. In the podia means food. Some cells as some false food. They develop the food to work and then, but that is not the real food. So that is called a pseudo, means false. Pio means pus. Anything pyogenic, which is pus forming. Pyro means fever. Anything related to pyro is fever producing, which cause your fever. Pyrotoxin, that is, these toxins can produce the fever. That is called the pyrotoxin. Semi is half. Bi is also half, but bi means half. What is called hemi? Hemi is also half. So it depends what is going to use at different places. Maybe have the same meaning. Hemi means up also, semi means up also. But hemisphere, that use, but we cannot use the semisphere. So that is the medical terminology has been stated that. We can say semi as a semicircular, is not the fully circular, is semicircular. Steno means narrow. When the artery or blood vessels become narrowing, it's called the, sometimes it's called the stenosis of the artery or vein or any area. So steno means narrow. When is the anything is getting narrowing, is called the steno. It's called the stenotic, this condition. Sub is under. Super is above. Super or supra, either is called the above or excess. Super saturated, you are making a solution with the sugar or honey, is super saturated with the sugar. tachy means rapid. We already know brady means less. Tachy means rapid. Tachycardia, rapid heart rate. Trans means across. Say trans. You are going through the ureter. Something you are going through, going inside. Transurethral. So it's across or through. Uni means one. Bi means two. Poly means more. So unidirectional is only one direction. Is interesting?
Very interesting. Yes, it is.
But lots to remember. That's the
Yeah.
thing.
Mhm.
Lots to remember the medical terminology. So you want to just go through that one? You have the D12 in your form, or you want me to, you just want to, or you can learn it later? Basically,
guess
when,
Yeah, we can learn it later, ma'am,
okay, so let me go.
because we already have all the illustrations and definitions there in D2L.
Yeah, you have it, everything. Yeah.
Yes.
So now we have learned about the prefix, which is going to stay first if there is any need. But prefix not always there, but root word and suffix is generally always there, right? We have just discussed that one. But those are the all prefixes generally used in the medical words to state the condition, to see what is the stage or state, the description. Suffix, you are going to tell you also the another condition when you are putting it at the end. So algia, anything is algia. Neuralgia means nerve pain. Neuro means nerve, neuralgia, pain. Blast is from the germ or primitive lymphoblast, from where something is forming. That is the blast. Centesis, puncture to remove fluid. It's not a surgery. They go through the needle or something like that, big needle or some kind of like that, and to go inside the puncture and take out the. So if you have fluid deposition, urine some area or in the knee or anything, what they go with a needle and syringe, yeah, they suck the fluid to remove the fluid. That is called the sometimes amniocentesis. That means the placenta. Sometimes they go there and remove the fluid. So is the puncture to remove the fluid. Centesis, that you have to remember. Amniocentesis, anything. Orthocentesis, when you are removing the fluid from the knee or something, that joint is called the centesis, is any kind of removal of the puncture, not by surgery, not by cutting, not by incision, only by the puncture to remove the fluid. Side means death. Bactericide, which kills the bacteria. That is the death. Ectomy is surgical removal. Appendectomy, nephrectomy, cardiectomy, so everything. Bronchotomy. So when there is any hepatotomy, so if there is removal of any organ or any part, is called the surgical removal. So centesis, a puncture to remove fluid. Ectomy is surgical removal. Anemia means blood condition. Leukemia means white blood cells. Leukemia, emesis, is showing the condition of the white blood cells. Genic means source. from where is coming? Pyrogenics. Pyro means which is going to produce the fever. Pyrogenic. So any compound is pyrogenic means this is can cause the fever. Pyrogenics like the pyrotoxin develop the. So pyrotoxin specifically is a pyrogenic product. Graph is machine which use to record or demonstrate something. It's called the instrument. So graph is the instrument and gram is the record. Okay. There's electrocardiograph is the machine which do the ECG, and electrocardiogram is the record. Same thing like the electroencephalogram. Encephalo means head or brain. So when you are doing the brain and recording something is called the electroencephalogram. Gram is the record. Electro is the electricity. We learned it that and electro is again the combining with the combining vowel. Cardio, again we have learned, is the combining vowel, and the graph. Electrocardiogram, same thing. There is only the difference in meaning. When is the electrocardiograph is going to tell you, oh, this is the machine. And when you are going to electrocardiogram, that is the record you are going to see in paper or in the computer or in the screen. So electrocardiogram is the record or the some picture or a kind of anything illustration. Iasis, condition of candidiasis. Candid is one kind of fungus. So it's going to state you what type of candidiasis is the infection of the fungus. Fungal infection, that is the candidiasis. Itis, I already tell you when you are doing that, gastritis, nephritis, itis, anything comes with the inflammation. Phlebitis, phele means vein, that you are going to learn from the root word, and itis is the inflammation. Here, there is no need of the combining vowel because it started with the I. The suffix is started with the vowel I, so there is no need of combining vowel. So it's called phlebitis. Lepsy is called the seizure. Everybody, epilepsy is when is a seizure. It's called the epilepsy. Lysis is destruction. Hemolysis. Hem means blood. Hemolysis. O is the combining vowel. Lysis, hemolysis. When in the destruction or the breakdown of blood cells is called the hemolysis. Megaly means enlarged. Cytomegaly means the cell has been enlarged. Oology, we already study up, right? Biology, microbiology, sociology, nephrology, cardiology, anything is biology, oology. So oology. So study of anything is oology. Oma is tumor, lymphoma, cytoma, melanoma, everything. When there is a oma, that is stating the its tumor. Osis, before we saw the leukocytosis, same thing. Cytosis is going to give you the condition of what condition it is. Leukocytosis is the condition of the white blood cells. Ostomy is surgical opening. Ectomy is surgical removal. And ostomy is surgical opening. Is the opening, is not removal. That is the difference you have to remember. Appendectomy, nephrectomy, that means they are going to surgically removal some part. And centesis is puncture to remove a fluid. Ostomy is the surgical opening. Colostomy is they are going to open, surgically open the area. Otomy, cut into. Phlebotomy, that means we are going to puncture, we are going to cut through. It's a small cut, it's a big cut, it doesn't matter. It's a cut into. Pathy is disease, like the myopathy. Penia is lack of anything. Leukopenia means in your blood there is a lack of white blood cells. White blood cells counts are less. Erythropenia. Erythro means red blood cells, red blood cells, RBC. So erythropenia means when you have less number of red blood cells. Thrombocytopenia, thrombo you are going to learn is the platelet. So when is a less amount of or lack of appropriate number or normal number of the thrombocytes or the platelets is called as thrombocytopenia. So you are going to learn a lot through one by one. So then feel is the attraction. Basophil is how it attract each other. Plasty, surgical repair. Rhinoplasty, rhino is nose. Rhinoplasty means surgical repair of a nose. Mammoplasty, sometimes where you are doing the surgical repair of your breast. So any cluster, mainly the plasty is any kind of surgical repair, anything. Nia is breathing. Apnea. A means nothing, right? Apnea means no breathing, dead. Hyperapnea. What is going to tell? Hyperapnea means? What do you think? If I say the patient is having hyperapnea, what that
Excessive.
means? Excess, fast breathing. Good. If I say hypoapnea,
Fast or excessive breathing.
hypo,
Less
low.
breathing.
Yeah.
Low.
Normoapnea,
Normal.
normapnea,
Maybe normal.
normal. Why maybe? 100%
I'm not
normal.
sure. I haven't heard.
Normal. From normal, normapnea is normal.
Okay.
Okay, good. Thanks for trying. Voices to make. Who makes it? Any process who makes the erythropoiesis. The process how the red blood cell form. Leukopoiesis. How the white blood cell is formed. That is the formation. How the stages it takes, the pathways it takes to form. That is the to make. Rage, excessive flow. Hemorrhage, too much blood is coming out from a cut or from due to some high blood pressure, you have tremendous hemorrhage, or inside something from during the stroke. Hemorrhage is the excessive blood flow. That is the hemorrhage. A RIA is flow. It's maybe so you can see the difference. Rage, when it's excessive flow, is used in the hemorrhage, and RIA, diarrhea, so it's a flow. It's also flow, but it doesn't let the diarrhea. We call the diarrhea. Sclerosis is abnormal hardening. Sclerosis can happen in your artery, in your vein, in part of your in the organ. So when something's abnormal hardening is called the sclerosis. Arteriosclerosis. Artero means artery. When is a hardening of the artery due to cholesterol deposition or fat deposition or any by other reason, it blocks, it's become narrow. So it's called the arteriosclerosis. As it became hardened, it loses its capacity to expand and contract. So then the blood flow is going to be hampered and it's going to be more and more narrow and narrow and narrow. Ultimately, it make it called the block of the artery. So Arteriosclerosis, arteriosclerosis. When is arthro? Is going to learn the root word letter. Arthro. People lot of time make mistakes. Arteriosclerosis by arthrosclerosis. Arthro is going to be the bone joint at atherosclerosis. Atherosclerosis. You are going to learn it. I'm just telling you, make sure the terminology you guys get. Atherosclerosis, arteriosclerosis, couple of things is going to be confused. Scopy, scope, we have understand an instrument, and scopy is the view, how you are viewing it. Like this, microscopy means you are doing the process with the microscope. We are going to do the microscopy to see this bacteria or virus or any pathogen. And microscope is the instrument through which we are going to see it. Stasis, controlling or stopping. How you are going to control or stop? Mainly it happens bleeding. Hemostasis, the stop of bleeding. Urea, which is anything related to urine, present in urine. Glycosuria, glyco means sugar, too much urine in the sugar. Hematuria, blood in urine. So anything suffix is urea is related to the urine. You want a break? Or do you want me to go
Yes,
to the
ma'am.
root?
Yes.
Okay, go for a break. Then you are going to the root word, okay?
When are we back?
When you want to come back.
Never.
Oh, I'm going to miss you. Don't say that. I'm going to cry.
I'm joking. I'm
I
joking.
am going to cry. I'm going to miss you.
No,
Sorry.
honestly.
I am so sorry that you have to stay with me for a long time.
No.
I
I'm enjoying your
I
class.
don't
I'm
know.
just
Maybe it's very
joking.
unfortunate for you guys. Who is okay?
Oh no, we're very
I'm just
fortunate.
joking. Yes,
We're very
yeah. I'm
fortunate,
enjoying this.
doctor.
I'm
Okay, no
enjoying
problem.
this. This is new to me, but I'm enjoying it. Thank you.
Okay. Yeah.
So are
If
we
you
back?
my request is, if you have any confusion, anything, discuss in the class. Okay.
Yeah.
So we can, don't feel shy. Anybody, we are from different. Right now, I am in this field. It's okay. It's okay. But it's not like that. I know 100%. Everything is changing. I also need to learn. So, but if you have any confusion, anyone, don't feel shy. Come out. Ask the questions.
Yeah. You're doing good, ma'am.
Yeah, we'll learn together. It's not that sometimes, it's like the IT things. You guys are helping me. I don't know. Go to this corner, go to that corner. Luis is helping or somebody is helping. I am learning. Like the computer audio, how to set it, I didn't know. So every day we are learning, right? Maybe you are the best in your field, but we have to learn together. Okay? Okay, go for break. No more talk.
So when are
Okay.
we back?
Or what time you want to come back?
You
20 minutes?
20 minutes? So what
Yes.
is
Yes.
now 10, 20,
10:20.
now
Yeah.
10:20. So 10,
Yes.
30, 10:40. Okay, go 10:45.
And for
Professor,
Oh,
Yes.
10:45. Thank you.
this is Hoda. I have an appointment at exactly 1. Can I request to leave like an hour early, so like 12 o'clock?
You can, but you are going to miss. Who is that?
Hoda.
Huda? You
Mhm.
can, but you are going to miss the class. That I can tell you.
That's fine. What will you be teaching in that last hour, do you think, so I can just go through the notes right now?
So basically, I don't know what I'm going to teach, but whatever's in the unit, I didn't check it, that one. Huda left 1 hour.
Okay, everything you're discussing is going to be on D2L, right?
Yeah.
Okay.
Yeah.
I'll
Only
just
the reviews, only some reviews and other things which I gave, that is I made it, that is not in the D2L. I don't know why I always DL2, D2L. So sometimes whatever the reviews and other things, that is from my study with the ML Power and other things. So doing the research and other things, so the reviews are not going to be the D2L. That is I created for my students. So that is going to be different. That is not going to be the D2L. But your main course, other things is going to be D2L. Okay.
Okay, so my question is, if I'm leaving 12, how do I get this material that you're teaching?
So that is already in your D2L.
Okay, all right. So 12
If
o'clock.
I send any review or anything, so I send you by the emails.
Okay, perfect. So yeah, 12 o'clock, I'll just be logging off, just so you know.
Okay. Okay.
Thank you.
Just send me a note at that time. When you are leaving, just send me a message in the chat. Okay.
Okay, thanks.
Okay. 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 So you are coming back at 10. What time I told you? 45.
Yeah, you say 10:45. Yeah.
10:45.
Okay, good. See you. I
Okay.
am not taking, don't call me. I am going to make some tea now. Okay.
Thank you. Okay.
Okay, enjoy. Okay, bye.
Okay. Okay.
Enjoy.
Okay, hope everyone is back now and you had a good break. You guys heard me, right?
Yeah, yes, ma'am.
Okay.
Yes, ma'am.
Okay. Okay. So let me go and hope everybody has a little bit good break. And you thought about something about the terminology, what you are going to use it. So now we have learned some prefixes, suffixes. Now we are going to the root word, which are the main words to tell us what is what. Okay, so starting alphabetically, add in means gland. O is obviously always there, but it has to be combined form. Adeno, anything is gland related. Adenopathy, anything is gland related is adenopathy. Adenopathy means condition, it's a pain or disease. What we learned before.
Hello, ma'am.
AER,
Excuse me.
yes,
We cannot see your screen properly. It is minimized. Can you please maximize? Thank you.
we were seeing it before. It's maximized it. I don't know whether I can zoom it. Maybe I can zoom it. Oh, it was 100%. Is that okay better or do you want to zoom more? Is that better?
Yes, ma'am, that's better.
Okay, sorry.
Thank you.
Okay, thanks for bringing the attention because I cannot see from your end. Okay, good. Yeah, my screen is maximized. These are in the Zoom 150. So what I told you, anything is is related to gland. Adenopathy means there is a condition or pain or some problem in the any kind of gland. And O is always, it is a combining vowel. Air, we call, that's why you are discussing at the beginning, the pronunciation, though is A-E-R, but we pronounce it as the air, right? Angi means vessel, anything vessel, angioma, any problem is maybe vein or artery, anything is called the vessel, angioma, blood or limb vessels, called the angioma is another condition of the blood vessels. Arthur is called the artery. Anything arter is artery, related to artery. Arteriogram. What that means? What is the gram we learned recent now?
Record.
Record. Very good.
Yeah.
That's, we are going to see the record of the artery. Something they are doing some procedure to see how the artery is blocked or anything or any changes in the artery. And if I say arterioscope, what that means? Doctor is going to tell, okay, you have to do a arterioscope. What do you think? What do you mean?
C.
No, the instrument. You have to use the instrument arterioscope
Instrument.
to
Yeah.
do the arteriogram. Okay? Clear now? You are using the arterioscope to do the angiogram. You are going to ECG, electrocardiogram machine to do that electrocardiogram. Okay? Good. Brachy means arm, anything. You are going to see brachial artery. Anything is related to hand is called the brachy. It's called the brachial. The position is brachial position is in the arm. Everybody knows is related to lungs. What is bronchodo? Is a passage conveying air in the lungs. So from we are taking the air from the nose, then is going to the pharynx and then is going to the lungs. So that is the passage from the nose. We are taking the breath in and is passing the air into the two lungs, left and right. So that is the bronchus region. So this is when there's a bronchitis, means you have the inflammation. Itis means you have learned inflammation. Inflammation may be for any cause, but it's the inflammation. Inflammation on the bronchial region is the bronchitis. Cardi, we already learned. Cardi means heart. Cardiogram means is the record of heart activity. Cephal, we already learned. Cephal means head. So hydrocephaly. So here is two things. Hydro is here prefix and cephaly is going to give you the root word. Hydrocephaly, the condition of the head. Inflammation. Hydro means there is some deposition of fluid or some inflammation of the due to fluid deposition is called the hydrocephaly. Coli is going to remember. Gallbladder. This is a little bit difficult to remember. Coli is gallbladder. Cholecystitis means when there is the inflammation of the gallbladder, we call the cholecystitis. So cystitis. So it's called the gallbladder. Coli, anything coli is gallbladder. Okay. Chrome, anything is color. Polychromatic. Poly means many, chromatic. This can take, these are the polychromatic in nature, means this can take different colors or this is has different colors. Polychromatic. Cut means skin. Cutaneous. Given is a cat but skin, but when you pronounce it, we do the cutaneous. It doesn't get cutaneous. This is cutaneous. This is the pronunciation. Cyan means blue. Cyanotic means the condition which is going to bluing up the skin. When it's called the cyanosis, means condition. Cyanotic means this is going to be blue color. Cyanosis means already blue is the condition, skin condition. The patient extremities, the hand and feet, those are blue. Cyanosis means that means blue. That means there is no blood supply. That is the impaired blood supply is blue. That means no blood is going there. Cyst, anything bladder. Cystogram is the record of bladder. Where do you see the bladder? Urinary bladder. That is one of the big thing in our body. Cystitis. Anything inflammation in the bladder is the cystitis. Cystogram to record the bladder activity or bladder structure function, anything. Cyte means cell. Cyto is cytology, study of cell. Leukocyte, here leuko is coming. The before leuko is giving you the condition, that is the prefix. Leuko is the prefix. Leuko means white. Leukocyte means white blood cells. Erythrocyte, erythro means red, that means red blood cells. Cyte is cells. So RBC, WBC, thrombocytes. Thrombo means what is the platelet? Thrombocytes, which is the spindle separate cells. We are going to learn later. Derm, skin. Dermatologist, who is specialist? Logist is the specialist. Logi is the process of study information. Logist, what the specialist in the field is called the logist. Dermatologist, skin specialist, cardiologist, heart specialist, neurologist, brain or nerve specialist, nephrologist, who are the specialist in kidney or the urinary structure function. Edema is swelling. Anything you go, everybody knows. So Edematous is the swelling condition. We have a edema in a neck or feet or anywhere. It's an edema. I just told you erythro means red. Say example erythrocytes. Fev, it's called feb, is fever. So we call it febrile. Ile is another condition. Feb, there is ile. So there is no need of combining vowel because I is already a vowel. Gastro, we already learned. Stomach, gastrointestinal. It is giving two things. See, intestinal is another root word. This is also another root word. So gastrointestinal combining vowel is O. Gastrointestinal. That means is a problem of gastric regions and also the intestinal regions where you have the intestine. Gastrointestinal. Genito. Genit is related to reproductive system. Genitals, urogenital system. So genitals means reproductive. Gluc is sweet or sugar. It's either comes the gluc or glycol. Gluco or glycol, sweet or sugar. Glycogen. Glycogen is another form of sugar. Glucogen is sugar. It's a hormone, sorry. Glucolysis, breakdown of glucose is called the glucolysis. Glucogenesis, gen means formation. Glucogenesis when there is a formation of sugar. So diabetes people have, they doesn't have the enough hormone to break down the sugar what we are taking. So there is formation of more sugar, accumulation of more sugar. Okay. Gyne is woman. Everybody knows gynecologist who deals with the, who is specialist in the woman system. Hema, hemat, everything comes with the blood. Hematology, hematoma, hemochromic, anything. Hepa is liver. Hepatitis, inflammation of the liver. Histo is tissue. Cyto is cell. Histo is tissue. That is a, people got confusion. Histo means histology. That means tissue. Tissue means it's a collection of cells to form an in an organ. Histo is tissue. Histology, study of the tissue. Histar is related to uterus regions. You can see how it's getting specific and specific. Hysterectomy, removal. Ectomy means removal, surgical removal. Hysterectomy means when they are telling the hysterectomy, they are not going to, doctor is not going to tell you or your patient, or they are not going to describe, I am going to remove uterus. No, there's medical terminology. Patient is hysterectomy. So hyster means uterus. Histitis. What is going to be the meaning of histitis? What is going to be meaning? Histitis, what do you think? If I say, oh, you have histitis.
Inflammation of the jaundice.
No,
Inflammation
not hepatitis.
Of the tissue.
Histitis, not
Cystitis of the
hepatitis.
tissue. Inflammation of the tissue.
No.
Inflammation of uterus.
Inflammation of the uterus. Hist is uterus. Hist is uterus. Uterus. So histitis. Inflammation of the uterus.
Cystitis or hysteritis.
Hysteritis. That's it.
Hysteritis. Hysteritis will be inflammation of the uterus.
Uterus. And hepatitis is the inflammation of the liver. Hepa is liver. Okay. Got it? Okay. Icter. Jaundice. Ectric means yellow color. Ectric. So when you have the jaundice, the doctors generally say jaundice, or sometimes the, what is the, these we are going to use in the lab. What is the color of the serum? Ectric. That means the patient has maybe jaundice, yellow color. When you are going to separate the serum and plasma, from there you can understand whether the serum or plasma is the clear or pale stray color, or is going to be more yellow, dark yellow, depending upon that, or lipemic, non-lipemic, depending on the fat. From there you can understand. So ictric is the jaundice, indication of the jaundice, ictric color. Laparo means abdomen. Laparotomy. What is tomy means?
Study.
surgical opening, right? Ectomy, laparectomy. If it is a laparectomy, see the difference. Laparectomy means surgical removal of abdomen or part of the abdomen. Laparotomy means opening, surgical opening only of the abdomen to see if there is anything wrong inside.
And like laparoscopy?
Laparoscopy, what is the man? Tell me, what is laparoscopy?
It's the view inside the abdomen.
Exactly,
laparoscopy.
exactly. And if I say laparogram,
Measures.
Would be a picture, a record.
record or picture. Good.
Yeah.
So you can dissect out how to do that. So if you know the root word, you know the couple of prefix, suffix, you can deal with any word. The medical term, you can form the word, you can dissect the word, you can get the meaning of the word. But only you have to remember. Leuco, we already told about the leuco means white. So leukemia means emia is condition of the white blood cells, leukemia. Okay. And here, see, there is leukemia, not leukemia. That's I'm just telling. Because here emia, this is the suffix word, right? This has the vowel E. So that's why we doesn't need the O combining vowel, right? So leukemia, we don't say leukemia, we say leukemia. Anything is lipo is fat, lipemic means you have the condition. The serum is lipemic, that means the serum has fat in there. Plasma is lipemic, it's a white, cloudy, so it looks like lipemic. So that means this patient, serum or blood, with seeing that before doing the analysis for anything, we can see this patient has a lot of fat. So lipo is fat, but lipemic. Here again, see, this is when you are saying they are telling lipo. But when emic suffix is adding, so then there is no vowel. So lipemic is not go lipoemic, it's telling lipemic. Clear? Lith means stone, anything is stone. Lithotomy means there is stone in there and we have to do the see what is going to, we have to do the procedure lithotomy. We are going to open your stones are sometimes in the kidney, sometimes in the gallbladder. So lithotomy, litho means stone. Breast, mastectomy, ectomy means incision, removal of breast. We are going to do the left mastectomy, that means left breast removal. Meaning is membrane, is not meaning. MEA is not meaning, means covering, mainly in the brain. Brain coverings is called the meninges. When you have the inflammation in the membrane, it's called the meningitis. Itis is inflammation. I is a vowel in the suffix, so there is no combining vowel, so meningitis. Malo, spinal cord, this comes confusion with people. This myo is muscle. This is myo is the combining vowel. Sometimes they will give the my also. My or myo is the muscle. Myopathy, pain is muscle. Pathy means pain. So myopathy, muscle pain. I am having myopathy. I have muscle pain in my cuffs. Myelo is spinal, relating to spinal cord, bone marrow, myelogram. That means what is gram? Myelogram? Myelo means spine.
Record.
Spine
The
of
record
record.
of the
Yeah,
spine.
spine.
Yeah.
Good, very good, very good. Necro, I already told you death, necroscopy. So it's the death of some tissue. Nephro is kidney. Necro is dead. Nephro is the kidney. Nephritis. Nephrology. Nephrology is tidy up kidney. Nephritis, itis is inflammation. Sorry, itis is inflammation. Nephritis. Nephrectomy, removal of the kidney. Nephrotomy, just opening of the kidney to see. You see the difference? When there is, we are changing only one root or suffix, it's changing that one. If we change the root word, it's going to change the suffix means is going to be same, only the what organ is going to be changed. In case of nephritis, if it is the carditis, is the inflammation of the heart. If I say the bronchitis, is the inflammation of the bronchus. If I say the arthritis, is the inflammation of the bones. You understand? Got it, right? Neuro is nerve. Neuroma. Oma means anything tumor. Neuroma. So that means tumor of the nerve. Noctro is night. Anything night is nocturnal. So that means when you are nocturnal, you are not sleeping at night. You are not nocturnal. So you are not sleeping at night. Onco, anything is tumor. There is a two difference. Tumor versus the gland. Adeno is gland. Onco is tumor. Anything is tumor related is the oncology. Okay. So you have to remember, onco means tumor. Anything is related to onco. Onco means cancer, basically. Oncology is the cancer mainly. It's a benign cancer or malignant cancer, that is the different things. But onco is cancerous, whether it's benign or so do we have more osteobone path. We already learned about the disease pathology. Osteoporosis means the condition of the bone is the what is called the bone became fragile.
Miss, I have a question.
Yeah. Anyone has a
I have a question. The lipo, which is a fat.
yeah.
Lipemic.
Lipemic.
Okay. What is
Lipemic.
the MIC? What does the MIC stand for? I didn't get that, and I don't see that in my note. MIC. What does that
No,
stand for?
IC. Okay, IC means related to.
Lipemic.
Oh,
Emic.
I
Emic.
see.
Emic and lip. Lipemic. Emic. And that there is a E, there is no combining vowel there. Lipemic. Lipo means feed. So we have to eliminate the O, and emic is condition. Lipemic. So these.
Okay, got it.
Got
Thank
it
you.
now? Yeah.
Yeah,
Okay.
thank
Okay.
you.
Okay. No problem. Good. If you have any question, clear it so that you are not going to make mistake.
I want to
Paid?
ask a question too. Sorry.
Yes.
Can I ask a question?
Yes.
Yes, please. When you were talking about the pronunciation of some letters, like G is
Yeah.
pronounced as Je. When
No.
it comes before letter E,
Yeah, there is
I
the genetics.
and Y.
Genetics.
So
We
when
call
you
them
like
yeah,
genetics,
yeah.
but for gynecology, we don't say gynecology. Why is that different?
I have no idea. They have set it. Don't
Okay,
ask me
I
that.
accept
What?
it. That's
Yeah,
the
yeah, yeah.
exception. No problem.
Yeah. What are the difference? It has been set for probably before my all forefathers born. So it has been set by the medical boards, right? It's not me. So
Yeah,
I
I get
cannot
it. There are
answer.
some exceptions to
Yeah.
some rules. So that's
What
one
are the
exception.
exceptions? Generally, they are going to give you, but you have to sometimes we are going to tell you because sometimes, oh, this is G. Why you are getting the genetics? So that has been pronounced like that. I don't know why, dear. Maybe I think the root words came from the Latin. In Latin is J. You understand? We are telling it here, but the all Greek word or Latin words, maybe it started with the J. So that's why it's called the genetics.
Okay, no problem. Thank you.
Okay. Yeah, whatever I think, I remember now, some Latin words are different in spelling. So from there, maybe it has come from there. Okay. So,
Another question, ma'am.
yes.
So the combining vowel is always the O.
Always O,
Always
only
O.
if there is in the suffix, if their
Yes.
starting one is the vowel, then we are eliminating or dropping the
Yeah.
combining vowel.
Yes. Okay. Thank you.
Otherwise, always combining vowel is O, except if they ask you the question, always the combining vowel is O, mostly O, except when the suffix starts with the vowel.
With the vowel.
Except
Yes.
suffix we start with the vowel. Okay?
Okay. Okay, thank you.
Okay, clear, good. Okay, so next, C. There are two things. That's why I'm telling you the Latin and Greek word. So in Latin, ped means food, pedicure. You all do pedicure, manicure, right? But when it's come to Greek, the ped means child. So always we are the pediatrician who is a child specialist. Pediatric department is the department who deals with the kids. So sometimes it depends upon what is the suffix or prefix coming. It changes the meaning of the medical word term. Pleb is vein. You are the phlebotomist. You are going to be the phlebotomist. Good, very professional phlebotomist. Say 100%. Sure. So phlebotomist means who puncture the veins, who do the blood work. Phlebitis, inflammation of the vein. We don't do that, but if I say fluoroscopy, what going to be mean that? The instrument which can visualize the vein. Phlebogram, if I say the phlebogram is the record of the vein. Right? Am I right
And
or
I know
wrong?
one word. Yeah. Phlebotomy. Phlebotomy.
Correct. Yeah,
Omi.
the procedure. Phlebotomy is the procedure. Phlebotomists do the phlebotomy. Phlebotomists are the specialists who do the phlebotomy. Did I say right or wrong? Understandable? No.
Yes.
Yes, good.
Yes.
Okay. Anything photo is light. Photometry means you are using the measurement of the light. Metry means measure. Photometry. New. Again, bronchus. See, the lungs are different parts, right? Bronchus is the tube which is connecting from our nose area to air, sending the air to the lung. But when it's coming specifically, you are speaking about the lung. It's either pneumon or pulm. So
Pulmonary.
pulm. So how you say pneumonia? So when you say the pneumococcus, that means the pneumococcus is which is causing the infection in the lung. So this coccus, this pathogen cause the infection in the lung. Pneumocystis means it is the inflammation of the lung. Okay. But when I say bronchitis, is the inflammation of the bronchus. Something we are dealing with. Lung is pulmonary. Pulmonary vein, which is going to the lung. Pulmonary artery, which is coming from the lung out. So this is the pulmonary, always refer to lung. Ren is kidney. Renal means related to kidney. Okay. Scler is heart. Sclerosis. Arteriosclerosis. Hardening of the artery. We had learned when you are doing the artery, artero, that time you have the arteriosclerosis. We have that one, right? So hardening of the artery. Hardening of any area is called the sclerosis. Septic infection, very bad infection, poisonous infection. Septicemia is in the blood infection. Septicemia is the infection. It's a very bad infection. When you have the septic shock, is very hard to recover. So that's why before the infection goes to blood too much, we have to do the blood culture and see what type of infection is there and immediately start with the antibiotics. Stoma is mouth. Sorry, stomat. Stomach, see, I am getting things. Stomat means mouth. Stomatocyte. I cannot remember this one. I always mix with the stomach. So it came out from my stomach. Stomat is mouth. This one not going to come too much, but it's stomat means mouth. Stomatocyte, that means cells in the mouth. Therm is temperature. Everybody knows the thermometer. Therm is temperature. Thorax, chest. Thoracotomy means opening of the chest. Thoracentesis. That means if there is something needs to be taken out the fluid by puncture, then is any fluid has to be taken out from the thorax is called the chest, is called the thoracentesis. So again, changing the suffix, you can change the meaning. Changing the root word, you can change the meaning. You can change the prefix, you can change the meaning. Thrombo means clot. Thrombosis is the condition of the clot. Is the thrombosis. We are having the thrombosis. In the heart, you are having blood clot. Thrombosis. Tome is knife. Microtome. Micro means which can do the very thin micrometer sectioning or division or cutting instead of sectioning, better to tell the cutting. Who can do the very thin, very micro means very small, which cannot be visible even in the naked eye. So they can do the very micro sectioning or cutting. It's called the microtome. This is an instrument. Tome is knife. Microtome is an instrument which can help use the knife to cut the
Tissue.
cells or tissue or anything in a very
Small.
extremely very thin. Yeah. Okay. Tox is poison, toxin, toxic. This is toxic, toxin, which produce the toxin make you toxic. Alcohol is a toxic to your body. It's kind of a poison. Smoking. Ultimately, it has a toxic effect because it has a toxin in. UR is anything the urine, urometer, the meter, the instrument which is helps to give the specific gravity, how thick or thin is urine. That is the urine. Vas is vessel, anything. Vasoconstriction. That means the constriction means narrowing or the it's not actually. It's kind of like that constriction. Vasoconstriction means they are going to use some medicine which can cause the constriction to increase the blood flow. Vein is vein. So vein puncture. So there is a different words which can give the colors. We already told you albino white, anthracite black or scald. Melan is black also, such a melanocyte which produce the black color or the melanin. So collard is green, seed is yellow, cyan is blue, eosin is rosy red, erythro is real red, jaundice is yellow, leuco is white, lute is light yellow, poly is not P-O-L-Y, P-O-L-Y is many, P-O-L-I is gray, and xanth means dull yellow. So let me go to your some PowerPoints which we can do quickly.
Yes, I have a question, please.
Yes, if I can answer, please. Yeah.
Like, can you emphasize a little bit more for the construction or
Constriction?
yes.
For what? You have
It
to give
said
me an example.
vessel. It said vessel construction.
Constriction means you are giving the pressure. You are making so you have a tube. You give the pressure. It's going to narrow, right?
Okay, so it's a narrowing off.
Yeah, with the
Okay.
pressure. You are narrowing it.
Okay.
Yeah.
Okay.
It's going to
thank you.
vasoconstriction. So if your artery or vein become narrow, so that
Okay.
means it's become constricted.
Okay.
It's become a narrowing or thinning or what I said. It's kind of narrowing.
Okay. Thank you.
Okay. So that's I give you you have something, tube or something in front of you. You just hold the pressure. You can see it becomes narrow. So that is the constriction.
All right. Thanks.
Okay. So now we have already learned. So I'm just going to go very quickly that the medical work components fall into 3 categories: root, suffix, prefix. Right? We learned that one, right? So root is dex, ain't, morph with the combining forms O, O, O. Suffix, itis, pre is the prefix. So itis is starting with the I. Any kind of vowel is starting with, it doesn't need to be put another combining vowel in that one. So prefix like pre, hypo, hyper, everything. So what is the concepts on medical terminology we learned so far? First is going to the prefix, if there is any prefix, root and suffix. So ultimately is going to make a word, medical term, prefix, root and suffix, right? That we learned? Yes? Prefix, there is no need, the prefix is always be there, okay? When there is need, there is going to come the state, hyper, hypo, pre, post, but root and suffix has to be always there. Suffix always comes after the root word. Prefix always comes before the root word. Am I right?
Yes.
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 Okay. So when there is root and suffix, which will come first?
Root
The root
first.
comes first.
Root. Okay.
The root
Good.
first.
Okay. Good. Good. So this type of questions will come. That's why I'm going to ask you the questions. So root. What is the meaning of root? I already told you it's a fundamental unit of each medical word, which gives the basic meaning of the word. And in the root, the prefixes and suffixes are added, right? This is the root word. You can add prefix, or you can add suffix, or you can add both prefix or suffix to make the medical term. Clear? Okay.
Yes,
Yes.
ma'am.
Okay. What is the suffix? Suffix was the short word part or parts added to the end of a word. End of a word. Okay. So that is also modifies the meaning of the root. Carditis. Card is the root word. Itis is inflammation. Is giving the meaning that inflammation of the heart. So that is the modifies the meaning of the root. Indicated by a dash before the suffix is itis. Emia, oosis, ectomy, otomy, oma, whatever we learned so far. So prefix. This is the short word part added before a root word. Before a root word is going to be added the prefix. That is also suffix and prefix role is to change or modify the meaning of the root word. And here they always comes after the dash. And for the suffix, it comes, this dash comes before the word. Okay, before the suffix word. So word parts begin with learn. Learn are one who learns. Relearn, to learn again. So how you can see how it's getting, the learn is the root word, then it's getting combining, is going to plus with er, learner. Here we are using the learner who wants to learn or who learns. So cardia forms the root of cardio. So see, the Greek word is spelling is the K. So we are not cardio. We are not exactly we are not exactly pronouncing the C. Sardio. Here the thing. That's why the cardia. You have the question. Why is that one Genesis by genetics? By why don't we don't see genetics? So the Greek word here for the cardio is K. Cardia. That's why the from the root word we don't say cardia or sardi. See, what is a cardi? So as the word comes from the main Greek word cardia, so that is the pronunciation of cardi. So Latin word lung is palmo, but it's the same. Latin word doesn't change something palm. Greek words are different. Combining forms or vowels, we already told when the suffix or another root starting with a consonant is added to a root. That is the combining vowel. We combine the two words with a vowel, commonly O is used. Root. Neur means nervous system, right? Nerve. Suffix ology means study of. So neur plus O plus logy, study of the nervous system. You can understand the breakdown now. Once we learn the prefixes, suffixes, root words, colors, now you can see how you are forming the words. Neurology. So neur is the root word, O is the combining vowel, and logy is the study, which is giving the meaning. Neurology. Neuro, we are going to study the regarding the nerve or nervous system. So O helps to make it easier to pronounce this. Neurology is, that says, it says. Neurology is going to be difficult, but neurology, so O helps to make it easier to pronounce. Combining form, so that's what is called the combining form. So in the root plus the vowel is called the combining forms. Only root plus the vowel is the combining form. Combining form that aid in X. What is that? When is X? The X has been changed to G. Pharyngeal, that is the rule. So when is ending with the X is going to coming to the G. It has been modified to the G. Pharynx, pharyngeal. Coccyx, coccygeal. When pertaining to eal means pertaining to the throat. Terminal position. Coccyx is our last bone, the coccyx. The terminal position of the spine. So coccygeal. So pertaining to the position, last terminal position of the spine. Thorax. We cannot say X. It has been changed to C. You doesn't ask me why it has been changed to C. It has been ruled. That's why I am learned. I am telling you. What is the background of changing X to C and X to G? I have no idea. Cervix, cervical. Pertaining to a cervix is the neck. So pertaining to a neck. When there is the RH factor, suffix begin with RH. When you add a suffix begin with a root, with RH to a root, the R gets doubled. See, hema, hem is blood, rage means bursting or forth. But when you are adding both of them, is coming hemorrhage. They are become two R. That's why I'm telling hemorrhage. Pneumoria, menstrual flow. When it's going to menace plus ria is going to come at the menorrhea, double R. So these are going to be the questions, the multiple choice. If they give you, kind of this hemorrhage, rhinorrhage, or menorrhage. So you have to make sure which is the spelling right. When there is a double R, that is the right answer. So these are the rules. Pronunciation, we already did. Is phonetic pronunciation provided? Repeat words loud. Pronunciation may change when the parts are combined. Vowels with no pronunciation must get shorter pronunciation. A, as in hat. Very small, hat. We are not, but shorter line over vowels gives long pronunciation. Say. So when there is a consonant at the end, it becomes short. When is a vowel at the end, A, E, I, O, U, kind of like that. So it's going to say. These are not that important. Okay, so what is more important, I'm going to focus it to you. Okay, soft and C. Candy. So is C become like the candy? It's not like the Mew Mew cat. It's a candy. That's you say. Okay, soft C as in racer. Racer. We don't say racer. So this kind of pronunciation problem. Soft G as in page. Hard G, grow. So here, nothing. We doesn't pronunciate the G, silent letters. That is to remember. We never say gnathic. We say nathic, right? So that is the letter with silent, like the pneumonia. With silent P is silent, pneumonia. So same thing, apnea. We just call the cessation of the breath. Pnea. We don't say apnea, penia. We generally call the penia. Nephrosis, dropping the kidney. Nephrosis. We don't say it's called PHRO, nephro. We didn't say nephrosis. PH, pro. We cannot spell any F, nephropsis, but it doesn't say. It's a nephroptosis. What are the different symbols we use in the case of histories, this is you have to review. When they put this arrow up, that means increase. When they put some R like this, that is the symbol is going to the left side or left side. This is up means above or the sugar has been high. So they can put the signal like the up. They can use the signal, the arrow down is the decrease. Abbreviation can save time, may cause confusion. Acronym, abbreviation from the first letter. This is important. Abbreviation from the each letter with a phrase ASAP, as soon as possible. Okay, as soon as possible. If in the question, if they ask you to write in the lowercase of any elaborate of the acronyms, you have to write in the lowercase. If they doesn't say lowercase, then you can write it in the each one. Like that, we have the ethics in the safety data sheet. S data D sheet. It should be the first letter of each word can be capital. Material safety data sheet, we miss. How you did it, I didn't check it till now. So these are the things you sometimes you have the acronym, you have to write it in the first letter of the each part of the acronym should be capital letter. But sometimes to confuse you, to see whether your attention detail or not, in the question you will see, write it in lowercase. You have to follow that instruction. They want to see whether you can follow the instruction, which is very important in your job. So this is giving an example. What part that always comes before comes after a root. After a root is a combined form, right or wrong?
Right.
Cardio, nephro. The O is the combining form. So it comes after a root.
Right.
EPD says it can also come a word that always comes before a root. Is that true or not?
Yes.
No. A word part that always comes before a root.
Has a prefix.
Say that
Yes,
again.
that is the prefix. Yes, yes. Combine the root cardio with the suffix logi. What is going to be the, see the spelling. You have to hit the right answer. Cardi, oh, you just not cardiology, not cardiology like this, not cardiology. You have to remember how to do that. Cardio, they are giving you cardi, combined from O and logy. So it's going to be cardiology. See the spelling. This is very important. These questions is going to come. The term musculo is a root word combining from prefix or suffix. Is both. Is a root word at the same time is a combining from, right?
Right.
So answer would
Yes.
be both A and B. So how to select the answer? You
Select.
cannot just say, you just only say A, the answer is going to be, you are going to, marks is going to be 0. If you only say the combined form, marks is going to be 0 because there is an option A and B. And you are asking the term musculo is A or an root combining from prefix, suffix, both. It's not prefix, it's not suffix, it's a root word for sure. And it's a combining from, there is a vowel after that. Here, we have learned when there is a suffix ending with R, what is going to happen when you are the combining form? R is going to be double, right?
Doubled.
Yeah. So you can see which one is the right. This is my root word is Rhine. Rhine. Okay. O is the combining form. There is only one R. There is only one R. There is only one R. Only this is double R. So this is my right answer. So if we just combine the following words, dia and ria. Dia means through and meaning means flow. How you are going to? Here is R, right? If they ask you, they will not give you this answer. They ask you, combine the following word parts and write. down the full medical term. What you are going to write? Dia, RHA? No, they are going to check when there is starting with again the R, this R is going to be double. So dia and then Ria. Clear?
Yes, ma'am.
Questions? You always ask questions in between. I like that. Anything? You wrote it down and you want to ask me any questions? Looks like you guys ready for the exam. Good. I'm so proud. So let me go to the unit number 2. Today, we are behind. So let us do. It's okay? We can go? We can learn a little bit? We can catch it up? We like to be good, right? I missed one day at the beginning. It's not me, but you missed means I missed too. So ultimately, so we'll catch it up. How's like that?
Okay, that's fine.
Good girls, good people. Everybody agrees? I see only
Miss,
2 or 3. Yes?
Miss, I want to ask you a question because I'm
Yeah.
not clear on this one. The one that said Tommy, knife, right? How comes it switched from the root to the end of the word micro Tommy? How comes the Tommy ended up at the end instead of the beginning?
Let me go back. I cannot just right
It's
now.
a root word.
Yeah,
Tommy.
just I have to open it. I cannot.
Okay.
I think then that would be a prefix because it's micro, small, knife.
Okay.
Micro
So
means small. Yeah.
Yeah.
Yeah, that's why.
that came before the root word in this.
Yes. Prefixes will come before.
That is where it was under suffix or root word or where?
Oh God, I can't remember.
It was on the root. I remember that, and I put a question mark there.
Okay,
Sorry,
okay,
guys.
let me. No. Hip.
There are 2 words, if I'm not mistaken.
No, I don't have this in the root and micro.
It's a root word. It's the root word. The last page of it.
Oh, Tommy is from the Tommy. Okay,
Yeah,
okay. Tommy.
T-O-M-E, yeah.
Okay, Tommy. Where are you, Tommy?
You're almost there.
Okay, Tommy.
There,
Tom.
there.
Yeah,
Right there.
Yeah.
So the answer, which is the illustration,
Yeah.
okay, it said microtomy.
It's
How
not
is
then Tommy. It's called microtome. Tommy is different. Why that is going to is going to be microtomy. This is microtome.
Okay, so
when you are going to say microtomy, it's going to be totally changed. Microtome is an instrument which is used to do the microtomy. Microtomy is the process. Microtome is the instrument. Okay, now what is your question, Asnet?
No, when I look how the word switch from, because all the others, when you use the root word, it started with the root word. But
No, it's not like that. No. You can have the prefix and root word, or root word or suffix, or prefix, root word and suffix. So micro is the prefix here.
Okay.
Prefix is always go before the root word. This is the root word, tome, right? So that is an example. Okay?
Okay.
You got it now? You got it? Micro is the prefix. It's going to give you the micro. If I say macrotome, it's going to be the large instrument to cut the large section. Okay?
Okay. All right. Thank you.
No, it's okay. Good. So it's and also microtome and microtomy. So Thora tome means we are going to do that. Thoracotomy means the process is going to do that. Everything. Okay?
Yes, got it. Thanks.
Okay, good. Okay, so now we'll go back. Good. When you are taking the notes is good. Uh-oh, what I'm doing this one, mark PowerPoint. We did this one, right? Course, this one we did. Yes. So here, you see, we can do the prefix. This is the micro, and this is the tome. So microtome. This one doesn't need the suffix here.
Okay.
So we can have the prefix and root or suffix, or you can the prefix, root, and suffix.
Okay, so
In
they are
any
interchanged.
in any combination. Okay?
Okay, got it. Thanks.
Yeah. So just quickly review this one. Prefix is short word but added before a word of root to modify the meaning. So prefix always before a word. That's we just saw this one in the microtome. Okay. So say for uni means one. This is the prefix, and lateral is the root word. Lateral means one side. Unilateral means only one side. Uni means one. Lateral means side. Unilateral means affecting or involving one side. Contra is means against. Lateral, contra means against, and lateral means side. So contralateral means opposite sides. It's against. Okay. So prim means first, primitive. That means occurring first time. This is the prefixes. This is the example. Okay. Bi means two. Bicapsid. There are 2 points. Capsid valve. You are going to learn capsid valves when there is a two toothpick types projections is called the bi. Anything bi means two, and capsid is projection. Tetra means four. Tetrahedron when you have four surfaces. It is structure when you have four surfaces, like a rectangle or square. You have four surfaces. A figure with four surfaces is called the tetra. Negative prefixes, these are the general, is called the prefix, any prefix. There are kind of negative prefixes. What that means, it is going to tell you the negative things, means either there is nothing or the absence or difficult or something like that. So a or and, which gives you whenever these prefixes comes with the before the root is meaning not without. I already gone through all the list, but just giving the emphasis. This is the second day. This is absence or removal or separation. Dissect, to separate the tissue from the anatomical for an anatomical study. When you are doing the biopsy, what you are going to dissect out the tissue to do the biopsy. Non is not. Non-infectious, which doesn't cause the infection or spread of the disease. Non-infectious. For giving the directions, there are some prefixes which are meant for giving the direction, like add, toward or near. Adhere means attach or stick together. Come, let us adhere together. Make a group. We are going to be the MedLab age group. Let us adhere together. That is towards. We are going to come closer. We are sticking together. We are staying together. That's a general example. Per means through. Is going to through the kidney, through the membrane, through the skin. That is the per. Percutaneous means when is going through the cutaneous, means skin. Percutaneous. See, I didn't see this one. Percutaneous, through the skin. Trans also means through. But it has been used in a different, like the transfusion. What you're doing, you are putting some blood or blood components into the bloodstream. So you are getting fusion. You are getting something which is putting in another body to get the fusion between the old whatever is there in your body versus the new. Whereas you need the blood. So trans also through, pars also through, but it's a different time. It's going to be used in different medical term to describe the meaning of the medical term, which gives you the size and comparison. Iso, whenever there is iso means equal. Isograft, graft between two genetically identifiable individuals. These questions is going to come. Isograft, graft between two genetically identical, individual, genetically identical. That means exactly they are same. Micro means small, microscopic, which is extremely cold, which can be visible through a microscope. Scope is an instrument. Micro is small. Here also the microtome is the micro means which is very, very small, which cannot be seen by the naked eye, and scope is an instrument. So this is microscope. With the help of microscope, we do the microscopy. That means we see the extremely small things, small cells, small pathogen, whatever is very small, which cannot be seen in the naked eye. We use through the microscopy. That the process is called the microscopy. You got it, Asnet, now? See, like the microtome, there is a microscope. Re is again or back. Regenerate. Huh?
Got
Hello?
it.
Okay. Re again or back, like regurgitation, backward or return flow. Sometimes we have the regurgitation when you are vomiting. That is the backward flow. What is this one? So sometimes the prefixes give going the time. Ante means before. Antenatal, before birth. Pro also before, in front, like the prodrome. Means you are seeing some soilings, some itching, some rash. You are feeling something's the droopy face. That is the symptoms. That's going the prodrome. Prodrome means symptom. That this is a disease from where the doctor can understand, oh, this may be this one. So this is the prodrome. So pro also before or in front of. Post is after or behind. That the post-menopausal. So postmenopausal means after menopause. Pre, they forgot to put the pre. Pre also before. Preprandial means before eating. Postprandial means after. So when they are the blood glucose testing, or liver testing, or some, especially the liver panel testing. So they are going to tell you the preprandial or postprandial. That means what you need to the fast or non-fasting regular. So preprandial also from the before. Pre means before, pro means before, post means after. Position. Ect or ecto, outside. Say for excise, that means outside, to cut out. Endo means within. Within your body is endo. Endoscope, device for viewing the inside of a cavity of an organ. Endoscope they are putting, so they are going to see your digestive system. They are going to endo, that is the endo. That means they are going to see only your digestive system. That is the endoscopy. And the upper part up to the stomach, endoscopy. When they are doing the colonoscopy, they are going to see your intestines. That is the colon area. So it's colonoscopy, or use the colonoscope. We use the colonoscope, the instrument, to do the colonoscopy. We use the endoscope, the instrument, to do the endoscopy. What is endoscopy? Viewing the inside of a cavity of the organ. Is not organ, is the stomach. Endoscopy. If the endoscopy in other place, that is going to be another terminology. Mes is middle. Mesencephalon, that is, cephalon is the brain. Mes is middle part of the brain. Questions? Questions? No?
No, thank you.
Oh my God, it looks like I'm a good teacher. No questions. I'm just making always fun with you guys. Don't take me.
You are, Mom.
Oh, thank you, thank you. So it's 11:50. You can see you have in your page this one. Okay, so I'm going to do that. Okay, what I'm going to do, I'm going to copy and paste it in the Word document and send you by email. Okay, right now. Or what you can do, you can see this one, right? This one? You can see
Yes.
this one, right? Okay.
Yes.
So, okay. What do you
Yes.
do? You try to, what is the write the plural form of the word, okay?
Okay.
Okay. So you guys work on that. I am 10, so we have 11, 12. So it's 11:51 now. So
Mom,
by,
it's not working. We cannot type in any words on it. Maybe we need to download.
you doesn't need to do it in your paper.
Oh, in the paper. Okay. Thank you.
Do it on your paper, okay?
Yes.
Okay. Then we are going to discuss it, okay? So do it on your paper. So it's now 11:52. We can see you until 12:05. I hope by this time you are going to be done.
We're going to send it to you, ma'am, or we just keep it?
No. We are going to discuss it right now in the class.
Okay, thank you.
And then the right answers within I am going to send you later, okay? After our discussion, okay?
Okay.
Good.
Professor,
Yes, ma'am.
quick reminder, I'm gonna be leaving 12. I'll probably have I'll open the Teams on my phone to like listen and stuff as
That's
I'm
good,
there.
but then probably we are going to take. You can take a little bit later when you come back. There is a self quiz, medical
Mhm.
terminology one that we are going to do in the class right
Yeah.
now. After that one,
No problem.
you can take it. You can take it when you come home from your appointment or something. Okay.
All right. Thank you.
Okay. Okay. Good. Okay. So we are going to make it 12:10. I am giving you some time, okay? 12:10, so that you can give the answer, and then we are going to see each other.
So you're sending it to our email, you said?
No. Just do it right there. Write in a paper.
On a
Yes.
paper.
Okay. Thank you.
Write a paper and do that one in your hand. Let us use some in our hand, not always the computer.
Okay, no problem. Thank you.
And then final one, the result with result, I'm going to, with all the correct result, I'm going to send you an email, okay?
Okay, no problem. Thanks.
Okay, no problem, dear.
Excuse me?
Yes?
Can you keep the words, the sheet words on the screen?
Yeah, okay, sure.
Thank you.
Sure, I made a mistake. It's my fault.
No problem. Thank you.
By mistake, I clicked that stop sharing. I was working something. Okay. Where is the share? Share. Okay, so I have to zoom it. Okay now?
Okay,
Yeah, thank you.
Okay, so there are 10. How I'm going to do that? Okay, can I see if I do the 125, you guys can see all of them? Oh my God, no.
I can
No.
see it. It's a
I
little
see,
bit-
I'm going to do that.
Miss, it's okay. We have it in our D2L.
Oh, you have it?
Yeah, we have it.
Okay, just do there then.
Yeah, I think so.
Okay,
Yeah.
do that then.
D2L.
Then do the, yeah,
Better.
if you can open it, that's fine. Do that there, okay? Okay.
Yes,
Yeah, it's
thank
under
you.
Unit 2. Okay,
Oh, okay.
thanks.
That's good for me and all of us. Yeah, okay, good.
Okay. Unknown caller.
Um,
Everyone done or little more time?
Done.
Oh, everyone. So
Yes,
you guys are ready for medical technology test. So we can take the test.
I don't think so, ma'am.
Yeah, you are. What is that? Okay, I hope by this time everybody is done. Let us see what D2L said now. So now, can you guys make whether you have did this one? Vertebra is going to be changed to vertebrae. Did everybody give the same answer? Did anyone make any mistake?
No.
Everybody give the same answer?
Yes.
Wow, that's why I
Yes.
told you guys are ready for the exam. Let us do
No,
the
not
exam.
yet.
Yeah, we can take the exam on Thursday. Okay. So phenomenon is going to be changed to phenomena. Okay.
Phenomenon.
Okay. Okay, matrix is going to be changed to matrices. Coccyx, coccyces. X is going to be changed. Y is going to be E. X is going to be changed to S. Coccyces.
I didn't get
Diagonal.
that.
Okay, so write it down.
That one was a little bit tricky for me.
I know, it's tricky for me too. Not
Yes,
only you.
me
Yeah,
too.
after years of working in this field, if you see me, I agree. I agree. This is, and I don't know what the rules came from. There may be some reason, but I don't know, dear. But unfortunately, I have to remember. I remember. But to be honest with you, this is you have to need for the exam and practice. After that, after the exam, nobody is going to ask you anything like this.
So,
Sorry. I should not say that, but that's true. That's true. But for the exam purpose, you have to learn so many things.
Miss, quick
Yes.
question. I got COCCYXES for
No.
coccyx.
No,
No?
that's not the
Okay.
right.
Oh.
COCCICES.
Oh,
That's why I
okay.
told. That's why I told you I don't know how it works, but that's the
Okay.
actually its outcome. Okay, so that's why
Okay.
I give you the answer key. Okay, so
Okay, thank you.
yeah, diagnosis is called diagnosis. So it's a multiple diagnosis is called the diagnosis. You have to do with the diagnosis of liver, heart, kidney, multiple organs. When you have to do the diagnosis, there is the difference in the pronunciation diagnosis because it's very common, like diagnosis, and this is going to be diagnosis. Diagnosis is the multiple, like diagnosis is only single. Ovum, how it turns into ova, nobody knows. But ovum is the singular form and ova is the plural form. Menix has been changed to meninges. When there is X, there is some issue. See, coccyces, meninges, X turns out to ES. See, coccyx, ES. When there is X, that means it's going to be turned out to the ES.
Yeah, change C or G
Yeah.
from X to C or G.
Yeah. You see, CSS or meninges. Embolus, emboli, these are very funny. Emboli, embolus to emboli, indices, sorry, index to indices. This you guys know, but yeah, I don't know the rule. If you ask me the rule, I have no idea. Alveolus to alveoli. If anyone of you find out what is the basic or what is the, just let me know. I'd like to know why they have changed this. Like, what is the rules from the plural singular to plural forms? Maybe there is some rule. Pelvis is pelvis. Curriculum, curricula. Thrombus, thrombi, and serum is sera. Okay, this is done. Okay, so let us go to the next one. This one you got it, or you probably have it in D12. Can you please check? In your D12, you have the answer key with you, or that is only for the instructor?
No answer key, ma'am. Only you.
Only you.
You doesn't have the answer key, right? Okay, so let me,
Yeah.
then I'm going to do what I'm going to do. I'm going to copy and paste and send it to guys. Okay, answer key. Okay, so though you guys have all the answers, but let me see if I can copy. Come on.
The words that ended with the U and S, it changed into an I in the plural form.
Yeah.
Hey, don't go there. Oh my God.
Can we attempt to do the medical terminology quiz?
Yes, yes, yes. Do that. That was going to next term. Yeah, you guys start that one, and then I can do this one and send it to you. Okay. Okay. You
Okay,
start the
thank you.
yeah. Start the medical terminology. Do it. I'm so happy. Do it.
Yeah.
That is the self test. Yes, that was the next. Yeah.
Yes. Miss,
Mm-hmm.
did I miss anything? I just had to move away for a minute, little one.
No. You are just doing they wants to do the self test. That's what you are doing now. I am working for you guys, and you guys working for the self test.
Oh, okay. So we're going to, okay, thanks.
Yep. Do it. You will have fun.
Okay, thanks. Yes.
Mhm.
Oh, sorry, I have my mic on. Yeah.
Done?
Yes.
No, not
Wow.
yet. Not
Okay. When everybody is done, then we are going to go there. Okay. So this one we did it, PowerPoint presentation that. So this one is done. This PowerPoint present is done. This I have to do it. Okay, then self-test. What is the unit 3? Done, everyone? Hello?
Yeah, yes.
Okay, you guys should tell me you're done. Okay. Everybody got a full score?
No.
Any mistake?
Yes.
Yes.
I have to learn again. Yeah. Learning.
Okay, sure. Okay.
Yeah, a couple of mistakes.
It's okay. That's we are learning, right? Okay.
Yeah.
Right. Yeah.
That's the self quiz is there. Okay.
Yeah. Okay.
Okay. So let me give you the answers. What is the time now? 2:44. Okay. So many files open. I took the test before I give you the test. And I judge myself first. Okay. Come on, files.
Did you get the full answer?
I made one wrong, but yeah, I get the full. That was the confusion level little bit, but I redid the test and get it then.
Where do you find the answer to the quiz? Or the mark, sorry.
Did you submit the quiz?
Yes.
Yes.
You didn't see anything?
No.
No?
I submitted and I got my grade.
Me
I
too.
get the grades and even the correction for the mistakes.
Yeah.
You got the correction for the mistakes, right?
Yes.
Yeah,
Yes.
that's they are going to tell you what you made the mistakes. Whatever you did right, they are not going to show it to you.
Yeah.
But you missed the questions, right? Once you didn't do that. Yeah, that's why I have to go back and forth a couple of times. Yes, let me see. Oh, that is the ethics. I am still on ethics, see? So do you want me to go through it or send it to the results? What do you want?
Send it, miss. Or you can
Send
go
it?
through it first. You can go
Yeah,
through
we
it.
can
But
just
you don't
go
have the
through it.
questions in front of you.
No,
but,
we don't.
Yeah, so that's what I'm telling. But there are some questions I know. What part that always comes after the root is called? Everybody should answer that because I told you probably 50 times.
Suffix.
Suffix, yes. So I should not share my screen. I should ask you the question. That's the best thing. Okay. So then I can know who did what.
How do we get back to the question, though?
I am telling you the question now.
Okay. All right, go ahead.
Okay. So dash apnea is the term. Orthopnea is a what type of form?
Suffix.
Orthopnea. No, orthopnea.
Combine.
Ortho.
No, what type of form?
Combining
Orthonia.
form.
Combining form.
Combining form. Ortho is the root word and apnea, pnea is the suffix. So ortho, O is connecting here. It's a form. That's why I'm asking you the form. I'm not asking the prefix or suffix or root word. I am asking you pnea in the term. Orthopnea is a combining form. Okay. So when you combine the root cardi with suffix logi, what is going to be?
Cardiology.
What is going to be the spelling?
Oh, there's going to be the vowel.
No, spell the word. Spell the word.
CARDIALOGY.
No A.
Again, yeah. So they do it again. Two people start talking. I cannot understand. One, please.
CARDIOLOGY.
Right.
It's
Cardi. O is the combining form and logi, cardiology. Good. So when you are going to combine the root rhine with the suffix ria, what is going to be spelling?
Double R.
Double R. And there will be combining form or no?
Yes.
Okay. So how the pronunciation is coming finally? Rhino, ria. Okay. Is the combining vowel is always an O?
Yes.
Yes.
No.
Good.
Yes.
Yes.
Isn't it an I for like itis?
No, if it is that is the if the suffix is starting with the vowel, then there is no need of O.
Oh, yes.
But in general, when they are combining vowel, it is always O. Only the suffix, if he started with the vowel, you doesn't need that. You can drop the O because already vowel is there in the suffix. Clear or not clear till yet? Okay. 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 So the root word in the combining form of entero is true or false. Enter is the root word or is the suffix or prefix?
Prefix.
Entero.
Entero's root.
It's
Root
root.
word.
It's root.
Root word.
It's
Yes.
root.
It's a
Yes.
root word. Yeah. Yeah. Prefix can change the meaning of the word. Yes or no?
Yes.
Okay,
True.
true.
Yes.
So all medical terms have a prefix or suffix. Is true or false?
They don't always have a prefix.
No.
Good. It's the same thing. Sometimes all medical term doesn't have the suffix also. Sometimes the prefix and the root word can also make you the medical term. So what is excision means? If I give you the choice excision, and I give you the option excision, what is going to be the right one? Nephritis, arthrocentesis, and appendectomy.
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 What if I the inflammation? Arthrocentesis, nephritis, appendectomy.
Nephritis.
Nephritis.
Nephritis. What is the nephritis means? Inflammation of where?
Kidney.
Kidneys.
Good.
Nephrons.
Good. The total kidney. Nephrons is the unit of the kidney, but nephritis is the kidney related. Okay. Surgical puncture. Appendectomy, arthrocentesis, nephritis.
Arthrocentesis.
Arthrocentesis.
Arthro means?
Arthro.
Yeah.
So tummy.
Bone. Yeah. So when they are taking out the fluid from the bone by the puncture is called the arthrocentesis. Okay. So what is the large? What is the another name of large?
Megaly.
Macro.
Macro. Okay. What do you mean by when I say all? What is going to be the terminology? Neo, pan, macro, para, tachy, anti, dia. Pan. When I'm saying neo, neo, macro, pan, dia, anti, para, neo.
Neo.
Yes,
Neo means new. Beside, beside dia, anti, tachy,
Para.
neo, para. Good. First, anti, tachy, para, neo, tachy. Against, dia, pan, neo, para,
Anti.
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 Through macro, pan, neo, para, tachy, anti, dia.
Dia. True.
Dia.
Dialysis. Yeah.
Okay. Yeah. Everybody is good? Good?
Yes.
Good. So, very good. Is there anyone have any confusion? Okay,
I
what
think
is
it
the
just takes some reading and digesting to get all these things down.
yeah. It is going to take a little bit time. That's why I'm going to give you some time to do that, obviously. Yeah. On combining from enables two word or elements to be connected, true or false?
True.
So O is enabling two word elements, say the root word or the suffix or prefix or the root word to be connected, right? Two word elements. Good.
Two word elements, yes.
Two word elements, yes. Should a combining from be used to put together earth and synthesis? What is going to be that?
Yeah.
Do you need a combining form?
Yes.
Yes.
What do you need?
Oh.
Which vowel you need? Oh, okay, good.
Arthrocentesis.
Okay, arthrosynthesis. Okay, good.
Synthesis.
Very good. So it looks like you guys understand good brains. Everybody has a very good brain. I'm proud of you guys.
Thank you.
Ma'am, the word element.
It will take some time.
Obviously. Yes, ma'am.
Moon.
Yes.
The word element becomes a combining form when the root word is combined with the vowel, right? The combining vowel.
Can you repeat it slowly, please?
The word element becomes a combining form
What
the
what
word
is
element, like when you
element?
pick
Element?
a word element, like when you pick two parts of the word, like maybe the root word or the suffix or something.
Element.
Element is not the question I'm asking. I'm asking, like, I want to get a clear definition of combining form.
Combining forms is that
Yes,
when
so
there
this
is
is okay.
Okay. Let me tell you. Cardi, heart.
Mhm.
When is Cardi/O, that is the combining form. Is
Okay,
combining
so when
by
it
a
is combined with the vowel, the combining vowel, it becomes combining
the combining form.
Okay, that's what I wanted to be clear on.
Okay, everybody is
Yeah.
clear? No, good, very good. When is combining with O, any vowel, that vowel is the combining form.
You know, the first question that came in the quiz, talking the muscular, musical or something, in our what's it called, PowerPoint presentation, it gave us the answer as A and B, and that was, it is a root word and it is also a combining form.
Exactly.
But when we picked, I picked the same A and B for the first answer in this quiz, and when I submitted it, that came as wrong.
Wrong. Yes, me too,
Yeah.
miss.
Okay,
Me too.
I'll check that one. Okay, just give me a second. Okay.
Yeah, me
Okay.
too.
Okay. I'll see exactly what language they ask. I'll see that. If they made mistake, I'm going to write to the department. Okay.
Okay.
Problem. Yes, it's not like that everybody understands. If you catch the right answer, I'm going to give them the feedback. Okay. So pre and post are prefixes that indicates a
Time,
state of time. Whether there's a pre, before, or after. Good. So how to define a medical work? So you had the question. What you are going to do following the statement in the correct word? First, you have to check the suffix or prefix or middle of the word. How you are going to do the suffix part? Okay, then
the first part of the word.
That is the root word. Yes,
the
and
root
then
word.
no, the first part of the word, the prefix or anything, and then the middle part of the word. Okay, good, very
So
good.
that word that they wrote in that question, is it medial or did they mean to write medical?
You say the middle part of the word, but it's the root
No, in
word.
the question. In the question,
it was the middle part of the word.
Medial.
Middle, miss in the mid position. Yeah, it stays in between prefix and suffix. In the mid position. That is mainly
Can you repeat the question? That's the question for this quiz. This one that you are giving answer to. Can you repeat the question?
How to define
word.
How to define a medical word?
Yeah,
Put
medical. So in our quiz, it was medial. They wrote.
Oh, sorry, medial word. Sorry. I am doing the medial word. Yeah, what is the medial? How to define a medial word? That means what is going to stay. Put the following statement in correct order. Medial. I'm sorry.
Okay,
medial
what does
word.
a medial word mean?
Medial means who it is going to be in the middle.
Okay.
Which is
medial.
going to be which is going to be the
yeah. Thank you.
Okay.
But miss, you see, that's a kind of like a tricky question because I read that and I thought it was medical.
I agree.
And I didn't think it was middle.
Yeah, I was confused too.
Yeah.
I am telling the medial, right? I am also telling the same thing, medical, because it's called as a medical terminologies in my mind, in my eyes is a medical. So
That's
it's a
what I was
medial.
thinking,
No, that's not. They will sometimes give you the tricky questions to
Yeah.
check your attention, whether you are really attentive. Like I made a mistake. This one I am telling you, this is the question I made the mistake because because I had the idea medical. Okay, and
it's not only you, like even when I read the question to myself, I thought it was medical.
Yeah.
So and then I thought it was middle. So I was very confused with how they worded
I told
that
you
question.
that one question I made the mistake. This is the question I made the mistake.
Okay. Thank you.
So I do mistake too. Yeah, it's not like that. I know 100%. Yeah.
Okay.
So
thanks.
a patient is in hospital with the cyanosis. What does this patient suffer from?
Decrease blood flow.
Condition of the
blood cells. Yeah.
Because I was trying to break it down. Cyano means blue. like
Yeah,
turning
yeah,
into blue. Then
yeah,
O6 means a condition.
yeah.
O6,
Good.
right?
Yeah,
Yeah.
yeah. So bluing up when it happens, I told you, right? The class, when there is a less supply of blood in your extremities or any places, so it instead of red, this turns out to blue. So because the blood is getting clotted, so from the superficial, you are seeing the bluing of the skin.
That means it's getting less oxygen. It's not getting enough oxygen.
Exactly. So it cannot. Yeah. So that is very good. Very good. What is the rapid heart rate called? Bradycardia, tachycardia? What is called?
Tachycardia.
Good.
Tachycardia.
When, if the medical term hypoglycemia, what does the prefix means?
Below.
Exactly. Below normal. Okay. Below or low. It can be anything. Okay. Below. Okay, good. So if I tell you anti, what that means? Painful, 3, above, away from, slow, against.
Against.
Okay. Brady, away from,
Slow.
above, slow. Okay.
Slow.
This, 3, 3 above, painful, away from, against.
Painful.
Painful. Try.
Okay, yeah, DYS.
Try
is 3.
Okay, good. Supra.
Supra, above.
Good. AV, ab is going to be
Away from.
Very good. What is the prefix of the word half?
Hemi.
What is the another? Good, half of the part. And when you use the prefix a and an, it means
absence.
Absence or without?
Yeah,
without or absence. Very good. The prefix peri means
what?
Peri.
Surrounding.
Okay, peri. Okay.
Peri. Yeah. Prefix peri means surrounding. Okay, good. And prefix dia means
through
or across. Good.
Across, yeah.
Both. Okay. The prefix endo and intra means
inside, within,
in or
In.
within. In or
In.
within. Okay.
Within.
Okay. Good. Okay. Good. Majority of you did it. Good job. You want the answer? You want the answer or no?
Yes, Miss. Can you send it to us, please?
Yes, please. Thank you.
Thank you.
Okay. So yeah, thank you very much for stay with me the whole class. I really enjoyed teaching with you today, with your all feedbacks, your suggestions and everything. Good, very good. I'm going to send you the result. Tomorrow we have covered unit number 1 and unit number 2. Tomorrow we'll try to cover unit number 3 and 4. So it's going to be tomorrow is Wednesday, right? Thursday, probably I will see whatever is going to be left. If not, I'm going to give you all the exercises and other things. You can do it at class, read, and Friday we can do the exam. Okay?
Yes.
Okay.
Okay, thank you.
Yes. Thank you.
Okay. Bye.
Bye.
Have a good afternoon.
Bye.
Okay, good.
You too. Thank you.
You too. Bye-bye.
Good.
Hi, guys.
Bye.
Bye, everyone.